There's always a new type of diet or workout plan and all these different fads, and there's just such an emphasis all the time on looking a certain way that of course people are going to end up engaging in the wrong types of behaviors trying to achieve that.
Like, I didn't really have any time for any other hobbies or anything else or any other mindset or anyone else in my life, really. Like, it was just me and, like, my eating disorder.
I would define my eating disorder as a physical manifestation of this sort of inner pain I was feeling.
It's like an anchor for me. It's like holding me back from things that I wish that I could do, or things I just...
And it told me I was going into eating disorder and that I needed help, and if I had not gotten help within the next couple of days, I would have been hospitalized and or dead.
According to a study done by the National Eating Disorder Association, 80% of all 10-year-olds are afraid of being fat. 42% of all 1st through 3rd grade girls want to be thinner. Eating disorder-related hospitalizations in children have increased 119% from 1999 to 2006. It is estimated that 10 million American women battle anorexia or bulimia, along with 1 million men. Time spent on social media sites can be linked to likelihood of developing an eating disorder. This can be attributed to the $40 billion diet industry. Although many other factors such as genetics, personality type, and environment play a role in the development of an eating disorder, society's obsession with being thin has dramatically increased eating disorder diagnosis in the last 50 years. Today, eating disorders have the highest mortality rate than any other psychological disorder. What are the different subcategories of anorexia, bulimia, or any other eating disorder?
There have been some new diagnosis codes added to eating disorders because people are finding ways to manipulate their weight. Type 1 diabetics, there's an eating disorder called diabulimia. It's actually a legitimate eating disorder. People will not give themselves insulin in order to lose weight, and every single time they end up in the ICU. I have a patient who goes to the ICU almost every weekend. She's been inpatient. It's one of the hardest eating disorders to treat because you could die very quickly from doing something like that. And then there's orthorexia, which can be confused with just healthy eating. Some people will just get on a healthy eating kick, and to their parents it's like, oh great, they're eating super healthy and no junk food, but they're actually can't eat any other type of food, and it just becomes an obsession. So whether they lose weight or not, the type of food they can eat the list is very short, and so they've termed that one orthorexia. And then there's also bulimorexia, and this one's not really new, and I'm not quite sure which category. Maybe it would fall in the EDNOS, which is eating disorder not otherwise specified. But there's people who have anorexia, but when they do eat, they purge. So that's actually its own eating disorder. Because usually an anorexic won't purge, and people with bulimia, they try to restrict, but it's not in their genetic coding to be able to starve. Most people aren't able to starve.
Right.
And so the people that can starve, that's where they get the sense of accomplishment from doing it until it turns into a problem, until it turns into they're not going to live anymore if they keep doing it.
Why is it so common that eating disorders start during puberty?
Well, that's one of the most common ages of kids that I see is when they go into puberty, or they've gone into it much earlier than their friends. They're not really told that all the details of what's going to happen as far as weight gain and the other physical changes in their body besides the reproductive changes. So what happens is they're gaining weight, and it's healthy for them to be gaining the weight, but they just think they're gaining weight. So what's missing is that they're not told that they're supposed to gain 20 to 30 pounds, or that having stretch marks is normal and that a lot of teenagers have them. So they think that it must be something they're doing wrong, or their body's not, they can't control what's happening to them. And even their parents were never told what's supposed to happen during puberty. So they start looking things up on the internet, or they start dieting, and then an eating disorder can start that early, at between age 9 and 14, because of that.
Is that more common to have kids at that young of ages now than?
Well, it seems like people are going into puberty much earlier than they used to. So 9, 10, 11, that used to be really, really young for someone to have an eating disorder, but it's getting more common. I haven't had anyone as young as 9. My youngest patient has been 10. But
This kind of goes with the previous question, but does health education in schools have an effect on your patients?
well, it does, because it's too standardized, in my opinion. There's a lot of information that's missing because there's a set curriculum of just how science works, and it doesn't work exactly that way in each person's body. So how one person uses food depends on how much muscle or fat that person has. It doesn't depend on how tall and they are and how much they weigh. And so a lot of it is based on height to weight and the BMI, and then it categorizes people. So if you're told in school that you're in the obese range, and you're really not, because you're in a sport, you're a soccer player or a cheerleader or something, and you're just put into a category of being obese, and that's not an accurate measure. So people are being triggered, and it's causing, I think the BMI issue is causing more harm than good, and there needs to be a different way to either measure people or to help people decide like what's healthy and what makes a healthy person, and then versus not.
What about the health education as far as elementary school?
So the video there's usually a video that everybody sees in like 5th or 6th grade. So boys go see a video, don't know what that video is about, but the girls that watch the video, they're given information about like body changes, but not really like outward appearance changes of what's going to happen to them. So without having that information, they don't know what's going on. They don't know that they're supposed to be gaining weight during that time. And for some girls, it happens so much earlier that they want to slow it down. That's a common thing, that wanting to slow down the weight gain, but they're not ready for it, and they're not told, not even by their parents, because their parents don't know either. So I think that's a big part missing out of that movie that everyone needs to see in elementary school. So another problem with what kids learn in school is it's what adults learn too. And so you've got kids that are in sports, and their coaches are trying to tell them how to be the healthiest they can be. And some of their athletes are fitting into the obese category or the higher than average weight category. And it's because they have a lot of muscle. So, I've had the way I measure people is different. I don't use the BMI. I go by body composition, so fat, water, muscle. And when I tell a person that their body fat's actually low, but their muscle mass is high, I'll have people ask me, well, how can they lose their muscle then? Because of their size. So the message that's coming from either the coaches or the other athletes is the smaller you are, the better, or the faster you are. So there just needs to be a better way to do measurements, or to even talk about it with kids, or just to not do measurements at all. Leave that up to a kid's pediatrician to tell them where they fall, or if they're an unhealthy weight, because there's no way for the school to know that. There's no way for a scale at school to tell you that.
Causes of an eating disorder. Eating disorders in general are very complex disorders, and there's not one thing that causes them, but there are definitely biological, psychological, cultural, social, and physiological precipitants that can contribute to the development of an eating disorder. So, to be more specific, Our society's focus on weight and size, our diet industry, multi-billion-dollar diet industry, family discord, a sense of disconnection or trauma, overemphasis on perfectionism. Those are just a few, of things that you put the right recipe together, and there you have it. But at the same time, a different person can be exposed to some of those same things and not develop an eating disorder, and so that's part of what makes it such an interesting field and such a complex issue.
I think I'm a perfectionist in the way, if I'm doing something, I want it to, be done, the way I want it, obviously. And I want it to be done, perfect. I don't want anyone to, look at something I did and, even have, guess that it was, done with, half effort or, I don't know. If I'm going to do something, I'm going to do it, 100%, so.
How do you think your eating disorder played a role in that?
Oh, it definitely played a role. I think, because I think in the beginning of my eating disorder, once I got into the mindset of, I should become healthy, I should get, healthier, I should start eating better and I should start working out more, I think I just went in, full throttle, and there was no, rationalizing anything. It was just you know what? Just go for it. And, obviously it led to some really unhealthy habits, so.
I absolutely consider myself to be a perfectionist, not even just related to the eating disorder in general, for sure, but even with my meal plan right now, I'm constantly trying to follow it to a T, and my nutritionist has told me that, as long as you do what you're supposed to do 90% of the time, you'll be fine, but I still find myself struggling every day to get exactly the right amount of carbs and the right amount of protein and the right amount of fat, and when I don't, I get really upset. Unusually upset for the situation.
I take an art class at school, and I'm always very serious and very focused with my artwork, and I try to make it look as best as I possibly can. I usually try and look my best. I just try and be my best self. I try and get good grades, those sort of things.
How do you think, the eating disorder came into play with that?
Well, my eating disorder, with my perfectionism, it came in because it was you want everything to be perfect. Your body's not perfect. And it kind of sparked it.
I would say magazines, absolutely. Media, probably. My family's really relaxed. In fact, they're kind of the opposite of being healthy, so they're really big people naturally. But it's probably the media, just being that certain people get popularity, I guess, so really attractive people or something, they get the spotlight or whatever, and I think that kind of bothers me a lot because I kind of want attention, but I don't want that much. And I guess just seeing people that are probably just like me up there getting all this stardom because of how they look, I guess I just kind of want the same thing a little bit.
What predisposes somebody to be more at risk? What I find that people, every client I've ever worked with that has an eating disorder tends to be extremely emotionally intuitive and emotionally sensitive, and they tend to have an emotional intelligence and an ability to read other people and their feelings and their tones that the average person doesn't have, which makes them really sensitive. And it's that sensitivity that I find that makes it hard for them to deal emotionally in the world. So there's that part of it.
How do people end up in your office with an eating disorder?
Well, A lot of times people with eating disorders don't know they have an eating disorder, but they know something's wrong, so they'll come see me to get help on what they should eat or to help continue with the diet that they're on, not knowing that there's a problem, or either a friend or family member will bring the person in because they know there's something wrong. So sometimes it's not voluntary that they come into my office.
Actually, I didn't even realize I needed help. It was my parents kind of found out from my school. I went to a charter school in Phoenix, and everybody was really, really close together, so they knew something was wrong with me. So one day my parents just showed up at the school, and they took me to a doctor, and they found everything out. And then I was brought to a nutritionist, and she told me about what was going on with me, and told me I was going into an eating disorder and that I needed help, and if I had not gotten help within the next couple of days, I would have been hospitalized and or dead.
Everyone in my family was really focused on their weight and on dieting because, they just kind of considered themselves to be like on the heavier side, and there was a lot of talk about dieting, but not really a whole lot of follow through, but that talk was still really like, I feel like that sort of was there throughout my whole life, and that really sort of influenced me to believe that and I was always praised a lot for being like the thin one and for having like that self-control, and I think that really influenced me to be like, oh, if I'm thin, I'll be happy, I'll be whatever, like people will like me. And I guess people don't really understand how much it affects someone with an eating disorder, so like even after that started to happen, they would still say things like that, and I was like, no, you can't do that. Right. Like, that's really harmful to me.
That's when we talk about the biological and the social and the personal, the familial and genetic precipitants that can lead to, like, the culmination of an eating disorder. And usually you will see some sort of core belief of unworthiness or not enough. Seems to be, like, one of the big things that I see.
Do genetics play a role in the development of an eating disorder? Like, why is it that one child from a family may develop an eating disorder and then the other siblings won't be affected?
Well, it is genetic. In anorexia, they're researching, there's actually a specific gene in anorexia that they're researching, but the research is still too new. But as far as families with addictive diseases, if a family has alcohol or any type of drug addiction, that's a lot more, they're a lot more at risk for having kids that have those issues. But it also takes the personality type of a kid. I mean, most people with eating disorders are like the overachiever, perfectionist type person, so you can have a brother or sister who's like that, and then another one who, isn't that way, and with what runs in your family, one kid could end up with it. But in twins, usually both twins would end up with the eating disorder.
I'd say my family triggers me because my brother is, he's a basketball player. He's a high school basketball player, and he's super active. My sister she's 8, but she's a competitive dancer, and so she has dance every day for like over 2 hours. And it made me feel like guilty and bad because I wasn't doing any sort of serious exercise. My family never really used to like point out things that I ate or anything, but on the beginning of recovery, when I was trying to gain weight and I was eating more foods and stuff, they did start pointing them out until I asked them not to, which is helpful.
My family triggers me in a couple different ways. My brother recently lost about 90 pounds, which is incredible, and it was so great for him. And listening to him talk about what he did to lose 90 pounds, which was healthy for what he needed to do, wouldn't necessarily work for me, but it still made me want to try and do those things. For example, part of my plan for my nutritionist is to have 3 meals a day and 3 snacks in between, and my brother would have just 3 meals a day. And part of my plan for my nutritionist is to work out 4 or 5 days a week for a maximum of 1 hour, and he could work out for more than that. And so hearing him talk about doing that made me want to do it, because I wouldn't mind losing that much weight, you know. And then on the other hand, with my mom, she is participating in a diet program that I'm not allowed to do because it doesn't align with what my nutritionist wants me to do, and she still talks to me about it. And I know that deep down she just wants to help me, but it's hard because being a part of that diet program before enabled my eating disorder to be worse. So I just have to not listen to what she says. At one point I was doing a diet that involved me eating 1,200 calories a day or less, and since I was a dancer very actively when I was younger, I had a really high metabolism, and so I also have a lot of muscle, which requires a lot more calories. And so when you go significantly below the amount of calories that your body burns at rest, it really ruins your metabolism. And so what happened to me was, not only did I stop losing weight, but I started gaining weight back because my body was trying to store everything.
Well, that's what starvation causes. It causes something that was discovered from the Minnesota starvation study. They did a study on men for, I think it was like 6 months, and they put them on a 1,600 calorie diet, which is not even really considered starving for some of the diets that are around, you know, now. Like, you just pick up a magazine and diets are like 1,200 calories. But what starts to happen is this semi-starvation neurosis, and so people don't know they're in it, and what happens is they just start getting like depressed, anxious, really obsessive compulsive. All they think about is food. They're moody. Like, people lose their sense of humor, and parents are like, this isn't even my kid. Like, they don't even recognize their kid anymore. Totally changes their personality. And so then that's where it crosses over to where they start to think that they have depression or anxiety, but if they just get fed, then a lot of them go away.
So in the beginning, or when I had my eating disorder, it's kind of scary because, like, I know it interfered, but I barely remember, like, what I was doing or, like, anything. Like, it was kind of like a blur, but I know it interfered in the sense of I would avoid any social situation that involved food. I avoided a lot of social situations so I could go work out. It just, like, interfered with, like, my whole, like, homeostasis and, like, balance, I think, as a person. Like, I would wake up extremely early to go work out. I would get home from school and I would only look at, like, healthy recipes or something, you know, like, it was just really, like, I didn't really have any time for any other hobbies or anything else or any other mindset or anyone else in my life, really. Like, it was just me and, like, my eating disorder.
In the past, my eating disorder interfered with my daily life, like, so much. I had no energy to do anything, and, well, I mean, in the biggest way it impacted me was obviously towards the end of my junior year, I had to go to an inpatient facility because outpatient therapy was not working for me. So I missed the last, like, quarter of school, and I had finished out the school year in Denver, and I missed my whole summer. I was there until July, so that was, you know, that was rough. But besides that, like even when I was at home, like, all I could think about was food, and all I could think about was losing weight or, like, what I had eaten that day and all of that kind of thing. And there was just not room in my mind for anything else. Yeah, it definitely affected my schoolwork. I didn't really have the energy to go through with a lot of my schoolwork. It was probably the worst grades I've ever gotten was that year, actually. And it definitely affected, like, my relationships too. Like, I just didn't have the energy to put the effort into them, or I just wasn't, like, happy. And so I wasn't, like, people would try to have conversations with me and I just wouldn't want to because I just couldn't.
It used to be, it used to be pretty bad, and I would usually just try and, like, separate myself from a situation and just...
What kind of
thoughts were you having before?
Before, like, I would freak out over just how much I was eating, like, compared to everyone else, or, like, I don't deserve this food, like, it's too much, like, it was...
I do remember there being cases where that would happen. Just kind of, if I skipped a day of exercising, because I was on a regimen per se, right? So if I missed the Monday or Tuesday of exercising because I had homework, I wasn't feeling up to it, I would get really, really upset with myself and say, Wednesday, you have to go harder than ever. You have to not eat anything and work out as much as you can because you missed those 2 days. And that would kind of feed the eating disorder thoughts. Constantly you're like saying like, hey, I can't have that food. It's going to make me fat tomorrow. But not anymore.
They could be bulimic for 1 week and die. They could go to sleep and not wake up. And then you have other people who can have, bulimia for years and years and nothing ever happens. The part that's different with somebody who, you can have bulimia too if you over-exercise. So if you purge your calories through exercise, that's considered bulimia too, if you're a normal weight. So, but the effects on your heart for that too, same thing. I mean, what happens is like your heart rate starts to get lower and lower. So the problem isn't while you're exercising, it's when you stop. So it'd be like a rapid drop in your heart rate, and then you go to sleep and you don't wake up. So that's how most of the deaths actually occur when you read about them.
So exercising too much, like as in bulimic over exercising, can actually kill someone.
Yes, it can.
I wouldn't think that.
I think this is kind of weird, but when I realized I needed help, it was probably when my hair started falling out. Because up until that point, I had kind of been like, no, I'm fine. I don't need any help. And then when I started having such severe physical reactions, it was kind of like, this is real. Because it didn't really seem real until then, if that makes sense.
At what point is someone considered malnourished?
Well, you can't really go by labs as far as being malnourished, because some people's labs come back perfect, but they have, they've been doing all kinds of dangerous behaviors, and so they think, oh, they're fine, but they're not fine just because their labs are fine. So it's hard to tell as far as like blood work, but in bulimics, if you're throwing up most of your food, if you're purging that, then you're not getting the nutrition from the food. So it's like you're not eating. You're getting the calories, but you're not getting the nutrition. So you could be, usually people with bulimia, their teeth start falling out, their hair starts falling out. Dentists usually will catch bulimia in a kid if it's been hidden from their parents because it erodes the enamel in your teeth. So, that's the other thing I have. I have people who are in their 20s that have complete set of dentures because their teeth are gone.
Like, for me, enjoying myself at parties, like, I can get super caught up in just thoughts about food, calories, fat, all this ridiculous stuff, instead of, like, focusing on having fun with my friends or, like, stuff like that.
I thought that if I was thin, like, I would be happier and people would like me and I would be perfect. And I think even beyond that, at some point it stopped being about me being thin and it started being about me thinking like that I didn't deserve to have food, or I didn't, like, that I wanted to not be alive, and that it was a really sort of twisted way of making sure that didn't happen.
My eating disorder has interfered with my life because, well, when I was at birthday parties, or I was at parties in general, places, anywhere really involving food, restaurants, wherever, I found it hard to focus on actual conversations and people. Like, at my best friend's birthday party, like, I had to, like, lock myself in the bathroom because she had pizza, and it freaked me out, and it's pretty awful.
So some of the behaviors that I started to re-engage in included restricting food, binging and purging, and then especially around the holidays when I had a lot of anxiety about going to dinners where there was going to be a lot of desserts and unhealthy food, for like 24 hours before I would leave, I would just only drink a little bit of skim milk, so just enough to like keep from passing out, but not enough to really feel like I consumed a lot. And then I felt nice and skinny, but not really, before I would go to those kind of parties.
From your experience, what has been the scariest health consequence that you've seen from starving?
Well, I've seen quite a few. Some, besides the miscarriages, I mean, I've had people end up with nerve damage. I've had people who are just teenagers end up with nerve damage and can't walk anymore, and that nerve damage isn't reversible. Also osteoporosis, which, because your bones aren't getting the nutrition they need, and so people will try to override it by taking vitamins, but you don't absorb vitamins if you're not eating and if you don't have the right hormone balance. So people get broken bones. By the time they're like 25, they can have like full-on osteoporosis. And I've had like a girl, she kicked a soccer ball and she broke her foot just from kicking the ball because her bones were so brittle from an earlier eating disorder. So yeah, there's a lot of physical things that can happen.
Is it more dangerous for a child to have an eating disorder than an adult?
Well, I would say it's equally dangerous, some for different reasons, but in kids, they're not done growing, so a lot of things can happen. I mean, some kids just delay puberty for a really long time, and that has consequences later. That's probably one of the biggest consequences, but it's hard to get that across to a kid because it seems so far away. I've had patients have miscarriages and trouble getting pregnant just from an earlier eating disorder because of the way it affects your hormones. But for adults, it can almost be worse because kids are forced to get better by their parents. They don't let them walk around having an eating disorder. Usually they get help, but with adults, they kind of can do whatever they want. So sometimes they're at more risk because of heart problems, especially with purging. If someone purges and exercises, that's like probably the most deadly combination there is because of the effects on the heart.
Oh.
Yeah, so it throws off your electrolyte balance. And so if you look at like statistics of how many people have died from an eating disorder, it's usually from heart failure, not from starving.
Oh, okay. So
So it's very rare for someone to die from starving. That would take years. In most people, it would take years, but usually it's because of the purging.
The fear of gaining weight or the obsession with being thin is the distraction. It's the thing the anxiety has chosen to focus on, to protect whatever else is going on underneath, and usually underneath is feelings and needs that aren't being addressed. So if we can get away from and treat the food piece, which then, well, if we can get away from that, therapeutically we can get to what the emotions are and what the needs really are. And when those can be met adaptively in other true ways, the need for the eating behavior tends to go away. So that being said, it's still very important in treatment that we focus on the food behaviors because they can be life-threatening, be it the restriction or binging and purging.
I've been in recovery for about a year now, and I was luckily able to maintain outpatient treatment with a nutritionist, like weekly weigh-ins, weekly visits with my nutritionist, and counselor visits, and as well as like a strict meal plan and like a gradual exercise plan. So, yeah, it was, I don't know, like I didn't really realize, like I didn't really fully understand what was really going on. Like I couldn't believe that, like I couldn't really ever admit that I had an eating disorder. Like I just thought there's no way that, like me, that I could ever have that. So I mean, it was really hard in the beginning to kind of realize, but I remember my first visit with my nutritionist, like she just put it on the table. She's like, you qualify for inpatient treatment. You could go away tomorrow and not be back for like 4 months. And I knew, like, I don't know, it was tough, but it was worth it to like just keep it like day to day on my own.
I started therapy a year ago, but I myself was not committed to recovery until after I went to inpatient treatment, about halfway through the time I was there, I would say, about 6 months ago maybe. I think what made me commit was when I got there, I did not want to be there. I was like, I'm not that bad, I need to go home, whatever. And I was just kind of going through the motions to make other people happy. And then I had been there for about a month or two, and things got really bad for me, and I started refusing food, and I had to get a feeding tube. And then just seeing how that affected everybody else in my life, I think that was when I really realized that I wasn't just hurting myself, that I was hurting other people. And I think that's what made me actually sit down and be like, I need to change, I need to fix this, because I'm not just hurting myself anymore.
2 years ago, I graduated from an IOP, so intensive outpatient program, and that was the most rigorous recovery I ever went through. So it was like skills and discussing with other people and kind of having group therapy sessions. Never really experienced that before, and that was pretty much the big deal for help, I think. Yeah, that helped me the most. It's the I guess lighter version per se of inpatient. So I could go home, I could eat whatever I want, but I'd still get assignments and like homework. I'd still have to talk to multiple people, like a dietitian, nutritionist, counselor, and psychologist, all in the same like day per week. So it was kind of an all-around therapy session for every single thing you could do. And yeah, we had certain food days. So you'd bring in a food that scared you, for example, and you'd have that, and then you'd fill out a paper saying how you felt about eating it. I never really had any problem with that because I just wanted to get out of there.
Person is too resistant or they're not getting better, we send them to residential treatment. But I've had patients who've been in like 5-10 different treatment centers that never got better. I've had people who are 45 and they had an eating disorder since they're 15. So it's not so much that they're untreatable, it's just once the eating disorder's in their brain like that, it just takes over, and eating disorders are like one of the hardest addictions to get rid of. Well, there's a lot of denial in eating disorders, so without the right support team and being told like how much you need to eat, what's correct, because you just don't even know anymore, it's so distorted. Right. And having like professionals that understand it, because people will try to explain it to a friend or family member and they don't get it at all. Right. So it can trigger even more behaviors if someone doesn't understand it. So the support is actually a big deal. I mean, it wouldn't be impossible, but that's a really big part of it, is to have a treatment team.
My family is very supportive. They're pretty much my support team. I never really had too many friends, so my parents being the only people I ever really engaged with, yeah, they were my support team. So like whatever I needed, they would get it for me. Like I pretty much owe all the resources I have had in the recovery to them, because they took the initiative. They found a nutritionist, they found the IOP programs, they got it all done for me.
At this point, more body image things than anything will be triggering. Like if people comment on my body in a positive or in a negative way, I find a way to construe it into something negative, which is very problematic, but working on it. And just like looking at myself, like I know in the past I've had a lot of distortion issues, like where I look at myself and I would see something different than what everybody else would see. And I've worked through a lot of that, but sometimes it still just kind of hits me and I'm like, whoa, like I need to stop. And that's probably like the most triggering thing I run into still.
Body image issues are definitely still hard too, especially because my metabolism still isn't quite where I need it to be to actually lose weight again. And I avoid looking in full-length mirrors if possible, and I don't really go shopping very much anymore. I probably won't do that until I feel a little more comfortable about my body, and it definitely affects the clothes that I wear. Like, I'm very particular about what I'll go out in, and if I have to get ready to go somewhere, sometimes I'll spend 30 minutes like changing my outfit because I don't look quite right in what I'm wearing, even though I realistically probably look fine.
Body image is usually the last thing we see come on board in recovery. Personally, my opinion on that is that you got to live in your body. You come to terms with the food, but feeling okay in your own skin and the changes that it goes through. It's hard. It's hard to let your body be, especially when it's been the object of your control for so long. And I think that in our culture, especially, there's a really tight association between who you are and your body. So I am my body is a really readily accepted assumption.
For me, it's just triggering when anyone talks about anyone else's body or anything, because it makes me feel like people actually notice that kind of stuff and it's important. Or when people talk about how much or how little they ate and things like that.
When I have eating disorder thoughts on a regular basis, when I'm in the moment, a lot of times I'll just sort of turn it around. Like if I'm eating and I'm like, oh my gosh, this is too much, like I shouldn't be eating this, I'll be like, no, this is fine, you'll be okay. And then later when I have more time to think about it, I'll go back and think, why did I have that thought right then? How can I prevent having those thoughts in the future? Body image is harder because it's more socially acceptable for other people to talk about. Like it's so much more prevalent in our society. But it's sort of the same method. Like if I look in a mirror or if I like get dressed and I'm like, oh my gosh, like I look so fat, I just kind of stop and I think, no, I'm not. That's your distortion. That's not real. And a lot of times I just have to kind of avoid like looking at those things.
Coping with food thoughts on a daily basis is probably one of the biggest struggles of having an eating disorder. I still am at a point where I'm constantly thinking about food. What am I eating now? What am I going to eat next? What can I eat later based on what I'm eating now and how that fits into my nutritional plan? And it's definitely a struggle to just eat what I'm supposed to and not worry about it, because so much of an eating disorder is in your head. And so when you're constantly thinking about food, it's really hard to just not think about food.
I think the biggest misconception that people have is that it's all about being thin, because it's really not at the core. It's not. Like for me particularly, I think I see that more because I also have depression and anxiety. So for me, it was a lot about not deserving or feeling worthless and just not really wanting to live. And so when people are like, oh, you wanted to be thin, I was like, yes, but also no. And I think that's something that really bothers me.
People are way too worried about what size they are and talking about dieting and talking about like how their bodies should look, how they want them to look, all these ridiculous things that really shouldn't matter in the first place.
We have a multi-billion-dollar diet industry in this country. There is this readily acceptable okayness with looking better, losing weight, and the next new diet fad to make you bigger, better, stronger, perfect, whatever it's going to do for you. I think that is a huge influence.
Anorexia is not a body type, it's a mindset, and it's really problematic when people do things like that. It just makes me kind of like think, I don't not respect them, but I'm like, you really need to educate yourself.
And I know a lot of other people that are currently anorexics that don't look sick and skinny and frail like people assume they are. So it's not just some, ubiquitous appearance. Everybody has different, aspects of that same problem. People think like you can point an anorexic out of a group of people. Definitely not true. And people can't just snap out of it. It takes years of recovery. I mean, it took me six years of recovery. Like that's a long time. And I know a lot of people that have done it for 20, 30 years and they're still in recovery. So it's not something that you can just snap on and off. But yeah, it's tough, but it's possible.
I remember my dad talked to my nutritionist and said, like, he was just shocked, like, why won't she eat? Like, I don't get it. Why, like, how could she be, like, scared to eat? And I tried explaining to him, like, it's not that I'm, like, scared. Like, it's a whole mental, like, that's just, like, the way my brain works, like, how it did work for, like, 9-10 months that I was just, that's, like, all I thought about. So I don't think people really understand that it's like a mental, like, recovery is a mental, like, rewiring, because you have to completely change your entire, like, mindset, the way you go about things. I don't know, it's just, like, it's a lot harder than just eating more, for sure.
At the moment, I'm pretty confident with my body and stuff. It got a little rocky over weight gain period, but it doesn't really bother me that much. I've kind of accepted that this is the way that my body is and has to be healthy, and yeah.